Good evening, ladies and gentlemen, and welcome to our Eating Disorder Hope webinar in conjunction with Project Heal. We're so excited that you've joined us for this really important topic tonight. We will be discussing scholarship funding for eating disorder treatments. And we have with us this evening Ali Hougnou, who is the Director of Volunteer Services at Project Heal. We were going to have Liana present this webinar tonight, but unfortunately she was unable to make it. But luckily we have Ali joining us, and we're looking forward to hearing her present on this really important topic. So welcome, Ali. And before we get started, I just want to point out a couple things to our attendees who are joining us live tonight. You will have the opportunity to submit questions to Ali regarding her presentation at any point during her presentation tonight. So you can do that through the questions pane of your control panel. So feel free to enter in any questions that you might have throughout her presentation. Go ahead and put them right in the questions pane of your control panel. We will be receiving all those questions and submitting them to Ali at the end of her presentation. So without further ado, I'd like to transition this over to Ali.
Thanks so much, Crystal. Thank you all for having me. I'm excited to be here and share some more information with you about Project Heal's treatment scholarship program for those suffering from eating disorders. So just a quick little blurb about Project Heal for those who are unfamiliar with us. So Project Heal is a 501c3 nonprofit organization in the United States. We're also a certified incorporated association in New South Wales, which is in Australia, and we're a federal not-for-profit organization in Canada. Our main mission is to provide treatment grant funding for people with eating disorders who cannot afford treatment, as well as promote healthy body image and self-esteem and serve as a testament that full recovery from an eating disorder is possible. Additionally, we also seek to educate the local community about eating disorders and serve as recovery mentors to those currently struggling with eating disorders by promoting our belief that full recovery is possible. Just a little background about Project Heal. The organization was founded in 2008 by both Christina Safran and Leanna Rosenman, who at the time were two teenage girls from Long Island. They met while undergoing treatment for their eating disorders and really became passionate about providing funding for treatment after seeing so many people in treatment themselves being denied coverage for the life-saving treatment that they needed. So to date, Project Heal has provided treatment opportunities to over 70 applicants throughout the US and internationally. We've partnered with 32 treatment centers throughout the US and Israel, and we've raised over $1 million. We also have several ambassadors throughout the US and the UK who are serving on our team to raise awareness and funds in their communities. And we also have established over 40 chapters throughout the US, Canada, and Australia who all serve to maintain the mission and values of Project Heal. So they raise money in their own communities for our treatment grant program. And just a little bit of info about me. As Crystal said, I'm the Director of Volunteer Services for Project Heal. I'm also someone who's recovered from an eating disorder and am very passionate myself about igniting change within our society in terms of the prevention and treatment of eating disorders and obesity. So to start, I'm sure this is a statistic that many of us are familiar with, and it's a really terrifying one, that 30 million Americans suffer from an eating disorder. And that breaks down into 20 million women and 10 million men. And some of the consequences of having an eating disorder include some significant health consequences, even as far as death, which anorexia nervosa we know has the highest mortality rate of any mental illness. There are also significant consequences relating to relationships, academic performance, work performance, missing out on life opportunities, and just overall pleasure in life is often non-existent. And at times the health consequences that are obtained in an eating disorder may not go away after the eating disorder, given how severe they can be on the body. So why that's significant is because currently only 10% of individuals receive treatment for their eating disorder. So we know that there are 30 million just alone in the US impacted. And in general, what we know from research is that 10% of that and around the world only receive treatment, which leaves generally around 90% without access to treatment. Oftentimes, that's due to the healthcare system, and particularly for the US, that involves insurance companies often being unwilling or denying treatment for eating disorders. I know for my own treatment, actually, I had a lot of trouble getting coverage, but I was really lucky that my mom's actually a hospital administrator and was able to take on my insurance company with a medical director at a treatment center, and was able to get for me over a year of treatment covered, which is pretty amazing, which is why I'm so passionate to help others get that treatment that I was fortunate enough to get. Research has demonstrated that early intervention, which is treatment, is vital to a successful recovery process. So the longer that someone goes without treatment, the longer their recovery process often is. So it's really important to get treatment earlier to when the eating disorder is identified, which is tricky in the way that our healthcare system works. And even around the world with the different healthcare systems, it's still a challenge. Additionally, treatment costs for eating disorders in the US are really incredibly high. The average cost for a month of inpatient treatment is $30,000. And oftentimes 1 month of inpatient treatment is not sufficient for an individual trying to recover from an eating disorder. They may need anywhere from 3 to 6 months of inpatient care. Additionally, costs for intensive outpatient through partial hospitalization programs range from about $500 to $2,000 per day. So these costs are the costs that insurance companies are unwilling at times to cover, leaving individuals either stuck to front the bill themselves or go without the treatment that they need. And just a little example of eating disorders, I had no idea the damage that the eating disorder was doing to me. And so it can be even hard to fight for coverage yourself for treatment, because at times you may not even think you're that sick. And so that's even where these insurance companies are doing additional damage by denying the treatment that these individuals need. To give you an idea of the treatment centers that Project Heal has partnered with, these are all of our treatment center partners. So you can see we've got a variety of treatment centers that offer different levels of care. Some offer only inpatient residential, others offer only IOP, PHP, and some offer all of the above. And some of these treatment centers are located in the US and others are abroad. So here's another breakdown of our treatment centers, and you can see some of our residential partners and then our PHP and IOP treatment center partners. In terms of how to apply for a treatment grant from Project Heal, individuals should visit our website and complete the online application. Applicants are asked to indicate the level of treatment that they are seeking, so whether that's outpatient, PHP, or inpatient, or residential, or anything in between. And they're also asked to indicate why. Our primary criteria for selecting grant recipients is motivation. Of course, we want to fund people who really want to recover from their eating disorders and are ready to do the hard work, because recovery is by no means an easy process, but it's absolutely one that's very much worth it. We rely heavily on the effort that individuals put into their application, as that indicates a level of motivation to us. Additionally, we offer a partnership with UCSD, that's University of California at San Diego. They have a fantastic eating disorder treatment center, but it's specific to individuals who have no insurance. That's our partnership with them, or Medicaid or state insurance, as UCSD contracts with most major insurance companies. Um, so it is an intensive family structured program at UCSD. So we do have a separate application for parents or loved ones to fill out along with the main application. These are some of the important questions that we ask individuals consult with their insurance company for prior to applying for the treatment grant. So you can see some of these questions include just generally getting basic information about an individual's insurance plan if they have one, any information about annual out-of-pocket costs, co-pays, any in-network programs, if they have any out-of-network programs, and any other information that's important for us to know about their insurance plan in terms of when the coverage starts and ends, and any secondary insurance they may have. These questions are important to us because there are times that we will work with an individual who does have an insurance company that will fund maybe a partial amount of their treatment, and we'll fund the rest of that treatment. That way they can get even more treatment than their insurance company would provide. And it also allows us to save on funds so that we can provide even more people with treatment grants that they need. So the process in terms of how to apply in the more extensive form, so on our online application, you must complete all of the questions that are asked in order for your application to be reviewed. The application is reviewed by our clinical advisory board, which includes a multidisciplinary team of experts who specialize in the eating disorder field. They will offer we offer applications on a semi-annual basis, so you can see the different dates associated with our treatment grant process. So we have a first round where applications are received by April 15th, and applicants are notified by June 1st, and the second round of applications must be received by October 15th, where applicants will be notified by December 1st. In general, all applicants are notified within 2 weeks of submitting their application in terms of whether or not they are being considered to move on to the next phase in consideration for the grant funding. If an application does meet our criteria and funds are available, we'll ask for more information to be provided, including letters of recommendations from friends and family, additional information from members of the individual's healthcare team, and any medical and financial information. At times, applicants may have a Skype interview with one of our clinical advisory board members just to obtain any additional information that we may feel has been missing from their application. Once an award recipient has been selected, the clinical advisory board will decide how much funding will be allocated towards the treatment grant, the treatment recipient's treatment costs. Grant amounts will be based on available funding and potential costs of treatment, and funding is released directly to the treatment grant recipient's patient account at the providing treatment facility or just directly to the treatment provider. And the clinical advisory board collects progress reports from inpatient and residential treatment centers on a weekly basis and from outpatient treatment providers on a monthly basis. So we'll fund all levels of care. Even if you don't need intensive outpatient, we will fund general outpatient treatment as well. I just wanted to mention that. There are some restrictions and additional guidelines to be aware of. Only those with Medicare and Medicaid are eligible to apply for our residential treatment grants. However, anyone can apply for IOP, PHP, and outpatient grants. If an applicant is not awarded a Project HEAL grant, the applicant may not reapply unless given specific approval from the Project HEAL team. Because we have an overwhelming applicant demand and very limited staff, we are unable to speak with individual applicants over the phone. That said, our website is really comprehensive in providing information about our treatment grant. And if there are any questions regarding any of the items, you can visit grant questions on our contact page, which will ideally answer any questions you have. And then just some more information about the program at UCSD. It is only for individuals under the age of 24, and it's only for individuals struggling with anorexia nervosa, and it does involve the family in that treatment, as that's the basis for the treatment program. And for more information about all of this, you can absolutely visit our website. And I would be happy, of course, to answer any questions at the end. So here's a great quote from one of our wonderful treatment grant recipients who is doing incredibly well. Her name is Liba. She's actually going to be speaking at our gala on Tuesday and sharing her story. But here's just a little quote from her, and there's a picture of her, which really encaptures her personality. She's wonderful. And so you can read that she shares that she's eternally grateful to Project Heal for believing in me and seeing what I could not see for so many years in myself. They believe that I, Liba, had the strength to fight for recovery. Thank you for Project Heal for giving me another chance. Thank you for picking me up when I was down and letting me have this incredible life-changing experience. I know I can go out there and change the world, and I could not have gotten to that mindset without Project Heal. So thank you. Thank you for being my cheerleader. What's so incredible is that Liba has been in such a good place for quite a while now. She's actually a volunteer with Project Heal, and she's co-facilitating currently a prevention program with me to high school girls. So it's really awesome to see her come full circle, and we see that with quite a few of our treatment grant recipients, which is just so, so incredible. So the incredible thing about Project Heal is we have such a powerful volunteer base, and there are ways that you watching this webinar can help us make a difference in the community and help save lives. So as I mentioned before, Project Heal has over 40 chapters throughout the US, Canada, and Australia. Here's a little map that you can see where our chapters are based. I don't actually think this is the most up to date, so there are some changes as we have added a chapter in Texas, and I think a few more on the East Coast. So we are continuing to expand, and so if there's a local chapter near you, I strongly encourage you to reach out to them and get involved. That would be a fantastic way to help us raise more funding to provide more individuals with the treatment that they need. And just a little snapshot, these numbers are not actually up to date anymore, as they've all grown. But this was at the start of the year where we were at, and it's exciting to continue to see all of these numbers rise, except for the treatment applications. As much as it's great to see people applying, of course, it makes us sad that we can't help as many people as that are applying as we would love to, just because we're one organization. But the more money we raise, the more people we can help, which is something for us to continue thinking about. And this is a quote from our co-founder and CEO, Christina Saffron, about recovery, that it is so much more interesting than having an eating disorder. She writes that life is so much more fuller. No one ever regrets recovering from an eating disorder, which is so, so true. So how do we raise our funds for our treatment grant program? We raise funds on a national level as well as within our chapters. So another thing to note is that funds that are raised by international chapters are used to fund treatment for an applicant within that country. So the funds that are raised in Sydney, Australia remain there, and the same goes for our Canada chapters. In terms of national fundraising efforts, some examples of how those funds are raised include our East Coast and West Coast galas. So our East Coast New York City Gala is actually this upcoming Tuesday, May 16th. And our West Coast Gala will be in October. And this year it's actually at Levi Stadium, which is where the 49ers play, for any NFL fans out there. So we're really excited about that partnership and the chance to host a fundraiser there. Additionally, we, on a national level, often use online fundraising campaigns, which we have throughout the year. We're actually currently running a birthday campaign because Project Heal turned 9 this this month, and it's also both Christina and Leanna's birthdays in May, so we do a birthday fundraising campaign. And that's just one example of the online fundraising campaigns that we host throughout the year on a national level that our chapters also participate in. But specifically on the chapter level, some events that they will host that are fundraisers. One that's really fun that our Southern California chapter hosts is a Harry Potter themed yoga class, which has been such a huge hit and is apparently very fun. I'm on the East Coast, so I sadly have not been able to attend, but I would love to one day because it sounds so fun. We have had chapters do some aerial acrobatic type classes as fundraisers, and we've also had some chapters do benefit concerts, all of which have been really fun. We love making our fundraising events actually just fun and enjoyable. That's always what we want to make them, just a good time for everyone who's attending, while also, of course, educational and sharing more information about eating disorders and Project Heal. Additionally, some of our chapters over the years as they've grown have held larger scale events such as annual galas, which is incredible to see. Some of them have raised over $20,000 to $30,000 in one event, which is incredible. We have a really great team of volunteers. I can't emphasize that enough, and they do a lot of great work. So some of the smaller scale fundraising events that some chapters may host include like a Dine to Donate, where restaurants will donate a portion of the proceeds that day or evening to that specific chapter, which is then transferred back to the national organization. Additionally, our chapters are also using online fundraising programs. We're just actually moving our chapters to all have pages on classy.org, which is where we now have a main fundraising page as well. So those are just some of the ways that our Project Heal chapters fundraise. And as I mentioned before, our ambassadors that we have, so those are individuals who don't have the time necessarily to run a chapter, as that can be quite time consuming, but still want to get involved and raise funds for us, as well as raising awareness within their local community. So our ambassador role is a way for those individuals to get involved and do fundraising events that work for them in their schedule, and still be a part of our community, which is great. And what's great is that you all can help us out if you are interested, of course, by applying to either start a chapter, which actually is on hold until August, but you can, of course, email me and we can talk about the possibility of starting a chapter. Or if you're interested in becoming an ambassador, that is another way, like I mentioned before, that you can get involved and help contribute to our fundraising. And I highly encourage you to visit our website for more information on eating disorders, as well as how you can get involved with Project Heal, and just to stay up to date on all the things that we are doing. You can also get more information on our new support program there, which we are offering for free. It's our way of kind of offering additional resources to individuals because we want to help more people beyond our scholarship program. So we've also launched this new support program, which is great. And we're at the point where I am interested in hearing if you have any questions. That's all the information that I have to share, but I'm eager to hear any questions that you have for me.
Thank you so much, Ali, for your wonderful presentation, just the overview of the incredible work that Project Heal does. It's just amazing to hear of all the lives that you've helped and supported through your work at Project Heal. So we appreciate you sharing that.
Thank you.
And yeah, we do have a few questions, and just a reminder to our attendees who are with us, you still have the option to submit any questions you have for Ali through the question pane of your control panel, as we will be asking all these questions to her at this point. So feel free to do that at any time. So one question is, can you speak to the involvement of Project Heal after a individual gets awarded a grant for treatment? Is there like ongoing check-ins, or how does that work?
Absolutely. So up until this point, so we do our best to fund the applicant through the amount of care that they need. And then from there, we will have check-ins with them. That can be every week or every month, whenever they feel is appropriate. It's usually that check-in is usually with one of the co-founders. But as we've grown so much and we have, so many treatment grant recipients, it's become difficult for, just two people to keep up with. So we're actually going to be connecting future recipients with our new mentor program. So as I just mentioned, we launched that new support program. And within that involves a mentorship program with people who are recovered and are certified mentors through our program, which we've partnered with Carolyn Costin on, who's very well known in the eating disorder field. So moving forward, they'll still, of course, have access to speaking with Christina or Leanna, but we want to make sure that they're able to have a mentor that they can speak with definitely once a week, if not more, in addition to their outpatient treatment, just to make sure that they have all the support that they need.
Great. Thank you so much for addressing that. Another question here is what if an individual doesn't have insurance, and does age play a part in the grant? I'm guessing as part of the grant criteria.
Sure, sure. So if an individual does not have insurance, they are eligible to apply for any of our grants ranging from residential through PHP, IOP, and outpatient. And the only age restriction would apply if you were interested in the program offered at UCSD Eating Disorder Center, as they require individuals are 24 years of age or younger, because it is meant for families and generally is adolescent based. Other than that, we don't have any age requirements.
Great, thank you so much. And I think you did go through this, but just can you speak in terms of some of the current volunteer positions or things that people might be able to get involved with?
Absolutely. So I mentioned earlier about the ambassador role, and that's a direct role you can apply for. We also have a general volunteer application on our website where you can apply to volunteer with a chapter either locally or remotely. So that means even if you're not near a local chapter, you can still get involved with a chapter. You can even take on roles such as social media management, events planner, things that can be done remotely and working with the team on a collaborative level are really very helpful and vital roles for our chapters to not just function, but to thrive. And by thriving, we're able to help as many people as we can. Some additional volunteer roles that have recently opened up involve, for people who are recovered from an eating disorder, they can apply to become a mentor, which is for our new support program. And that's also available on our website under the tab called Communities of Healing. And that's where you can read up about our support program as well. So just to recap, volunteer opportunities, we'll be reopening the chapter application in August. So August 1, you can apply. But if you are interested and want more information now, you can email me, and I would be more than happy to provide you with that info. And then there's the ambassador application, which is currently on our website and live. And then there's the general volunteer application. You can also, if you don't want to directly volunteer in any of those ways, we would love for you to go to our page on classy.org. You can find that link on our Facebook page, and you can create your own fundraising page for our birthday campaign and help contribute to our goal. It's a peer-to-peer fundraising model. So essentially you create a page under our main page, and then you share that with your contacts, and the idea is that maybe someone from your network creates their own page linked to your page, and we can maximize the reach of how many people we're able to obtain donations from. So that's another way you can get involved that's not as, I guess, direct as some of the other opportunities available.
Great, thanks for explaining that, Allie. That's really exciting to hear all those potentials.
Definitely.
Another question here is how many males apply for the grant, and if you could just speak to maybe gender in terms of criteria for the grants.
Sure. In terms of the breakdown of male to female, that unfortunately I'm not able to speak to. I don't know that direct answer, but if the individual would like to email me, I'd be happy to check in with my team and get that answer for you. That said, we have funded male treatment grant recipients. I don't know the exact number of how many we have funded, um, but I do know, I want to say maybe around 10 to 15, maybe more. About maybe, that's a very much an approximate guess though. In terms of criteria, we don't have separate criteria for males versus females. Like I noted earlier, our primary criteria and what we look for is that motivation piece to recover. I guess criteria speaking from eating disorder standpoint, we would want to see if we would want individuals to meet specific eating disorder criteria. That said, our clinical advisory board is filled with many of the top leading experts in the field, so they would know what to look for as well in terms of a male or female who needs treatment, because I know that the DSM criteria can still be a bit murky for males with eating disorders. So that may be the concern in whoever's asking the question.
Hmm.
I wish I could provide more info. I just don't have too many specifics.
Sure. Thanks, Ali. That's really helpful. And then another question is in regards to treatment centers, is it specifically one of the treatment programs that collaborates with Project Heal, or if a person is interested in going to a specific treatment center, can they still apply for a grant and have it funded for one of those programs they have in mind?
Hmm. Okay, so I think the question I'm hearing is, do they have to only apply to one of our treatment center partners? Is that
Yes.
Yes.
Hmm.
Okay. So the answer to that is no. You can apply to receive treatment if you have a specific organization or facility in mind that we are not partnered with. You can certainly indicate that facility. We would just, as I mentioned earlier, want to know why you would like to go to that specific facility. The reason that we have the treatment grant partnerships is so that we can offer more treatment to individuals. Those partnerships often come with a specific I guess, arrangement. So with specific centers, we usually get like one fully funded residential treatment center on treatment grant funded by that treatment center, if that makes sense. So again, we're always looking for ways that we can provide more treatment and more support to people. So that's another way, which is why the treatment center partnerships are really exciting.
Yeah, definitely. Thank you for clarifying that. Another question here is if treatment is required through different levels, so like, residential and then stepping down to partial or IOP, is this something that the Project Heal grant can help cover as well?
I have seen at times that we have been able to cover different levels of care for our treatment grant recipients, yes. But I don't think it is guaranteed. I think it depends on um, I think I know everything depends on individual circumstances. So while I've seen it happen for others, I can't guarantee that it would happen for everyone who applies.
Great. And then kind of piggybacking on that, if a person has already gone through a few different levels of treatment, is that something that's looked at, or will that count against them if they're trying to apply for a grant?
Hmm. Sure, sure. So that is something that we do take into consideration. It does not mean that we're not going to fund that person's treatment, and that's coming from me. I'm someone who has been to so many treatment centers that I didn't think I would recover, and I did. So that's the other thing that we know is that sometimes people just need to go until they find the right fit for them. So it's something that is looked at. We will probably ask, for you to indicate kind of why did you need to go to a few different places, and to kind of explain maybe what you learned at each of those treatment stays. and why, you're looking for additional treatment. Um, because we just want to make sure, there are some people who have never been able to access treatment, and we want to make sure that in considering all of these factors that, again, we're funding an individual who's really motivated to do everything they can to fully recover from their eating disorder.
Sure, thank you. And then another question here is for all the individuals and applications that you receive, obviously you can only allot a certain number of grants. Does Project Heal have a referral source for the other individuals whom can't be, given a grant, or do you assist them in any way in terms of connecting to other resources, or do you have any other resources for people who are still searching for help funding their treatment, but who may not necessarily, get a grant through Project Heal?
Mhm. Sure. So, as I mentioned before, the new support program, which not only involves a individual kind of peer-to-peer mentoring, we also within that offer a free support group that's offered to the public. So that's one way that we are trying to, again, help people who are in need of additional support, and maybe didn't get funded by our treatment grant. In terms of referrals, I'm not sure if they are directly provided referrals. That said, I do know that if anyone ever asks for referrals, we are more than happy to provide you with those direct referrals. I even do all the time. So I would be more than happy to assist as well. I'm very passionate about helping people access the treatment that they need. Even if, we can't help fund it, I would be happy to do the research and help you in that way. And then we are trying to figure out alternative options to allow us to fund even more people again. And we're exploring potentially having people try to fund through their insurance company, and then if it doesn't go through, we'll fund it and then try to potentially see if we can get reimbursement from the insurance company and fight that denial. So we're exploring our other options, but again, in terms of referrals, I know that we have a ton of info on our website, but I'm also happy to assist as well.
Great, thanks so much, Allie. Just a couple more questions here. One of our attendees is wondering if the household income plays a role in approval, or is it just insurance availability?
So household income is part of the assessment. If or application rather, if an individual moves forward in our application process, that is where we ask for various financial forms, a copy of I believe like either a W-2 or just like bank statements to see, to get a sense of the individual's current financial standing, because that is a consideration for us, as well as the insurance piece.
Thank you for addressing that. And then just a final question we have here is, what do you see as the future of Project Heal, and where would you like to see Project Heal evolve and go to?
Oh, what a cool question. That's great. So where I see Project Heal going, I mean, I hope, I would love for our support program to really take off and have, it's actually running through our chapter structure. So I would love to see it in all of our chapter areas, and then even beyond that, even more, because that's a real way we can help so many people, because it also involves a prevention component. So we're helping people recover while also helping prevent the onset of future eating disorders, which is really powerful. And in terms of our treatment grant program, I would love to see if we can find a way to really fund even more treatment grants, which would be through some corporate sponsorships. It would be amazing to lock those in and really help take us to the next level so that we can help even more people. I mean, I would love, you saw before how we have, even last year we got over 800 treatment grant applicants that we received, or applications rather, and we were able to fund, I think, like 26 of them, and that's it's so unbalanced just because we're a small grassroots organization. So I would love to see us expand in that, but we need the community's help to do that. We're a three-man team. We have three full-time staff members, and the rest are all um, primarily volunteer based. So as much support as we can get from the community will help us get to where we need to get to. And we're also dabbling in some research too. So we're hoping to help expand the field in that way, because there's such a lack of research still in the eating disorder industry. And if we can provide some more insight into appropriate treatment and support protocols, as well as prevention and even relapse prevention, those are some goals that we have in mind for the upcoming years. And we would love for your help and support in those efforts. I really appreciate everyone for joining us tonight, and for all of your great questions. Those are really awesome. So I really appreciate that.
Thank you so very much, Ali. Again, we just really appreciate you being with us and taking the time to share in depth about Project Heal, and again, all the wonderful work that you and your team are all a part of. It's just a beautiful thing to hear and very encouraging, especially since there's such a gap for so many people who need treatment, but yet that component of funding treatment is lacking. So we just
Absolutely.
thank you and your entire team for all the work that you're doing.
Thank you so much. That means a
Yeah,
lot.
absolutely. And then for our attendees who are with us now, I did put the link to the Project Heal website in the chat box if you want to go directly to their site now and check it out. And you have Ali's contact information here on the slide. If you joined us late, we will be sending out a copy of the recording, so you will have access to the webinar that you can watch over again. And on behalf of Eating Disorder Hope and Project Heal, we thank you so much for your time in attending this webinar. Feel free to check us out at eatingdisorderhope.com. You can find a schedule of our upcoming webinars, as well as articles, links, and other various resources that can help support your eating disorder recovery journey. So thank you all for being with us. Thank you, Ali, and we wish you a good night.
Thank you.
Bye.